Hi, everyone. Welcome to the last panel of this seminar series, Citizens on the Move, Accessibility and Mobility in the Global South. This panel is called Emerging Citizenships and Urban Access and Mobility, Contestation, Demands, Rights, New Identities and Social Groups in Urban Areas. It's a pleasure for me to be chair of this panel. For those who don't know me, probably most of you, I'm Ignacio Tiznado Aitken. I'm a postdoctoral fellow and research coordinator of the Suburban Mobilities Cluster at the Department of Human Geography at the University of Toronto, Scarborough. And today we'll have three presentations with case studies from Argentina, Brazil, and Colombia as well. And we will have an amazing commentator as well, Jorge Blanco from Universidad de Buenos Aires. Jorge is a geographer and Master of Science in Environmental and Territorial Policies. He is the head of the Institute of Geography at the same university, and he's also Associate Professor of Spatial Planning and Transport Geography. His main research areas are spatial and environmental planning, mobility and social inequalities, and infrastructure policies. So thank you so much, Jorge, for accepting the invitation for today's panel. It's a pleasure to have you here as well. As I said before, we'll have three presentations for this session, and we have 2 hours. So I think that we can manage to have like presentations around 15 to 20 minutes. Then we'll have a space for Jorge to provide some comments on all the presentations. And then, of course, we will open like a discussion for all the attendees. So I think that we are ready to start. I see all the people who will be presenting in the session. So the first presentation will be made by Luisa Mattioli from Universidad Nacional de Avellaneda about segregation processes in territorial of urban expansion with a case study in the area of San Juan, Argentina. So please, Luisa, the stage is yours. I will let you know when you have 5 minutes left.
Gracias, muchísimas gracias por la presentación. Voy a compartir pantalla. A ver, un segundo. ¿Se logra visualizar?
Sí. Yeah, we are seeing your last slide, I think, but yeah, we can see it.
1 second. Ahí está. Como dijo el presentador, va a hablar sobre la segregación en territorios de expansión urbana, un análisis de transporte público de pasajeros en el ámbito del área metropolitana de San Juan, en un periodo de tiempo del 2020 al 2022. Primero que nada, esta presentación se basa en un caso de implementación de una nueva red de transporte público de pasajeros en San Juan, Argentina, llamada Red Tulum. Y merece la atención debido a que tiene particularidades propias del proyecto, siendo un caso de relevancia a nivel nacional. Primero que nada, voy a hacer una pequeña descripción o caracterización de la provincia, ya que está ubicada al oeste de la República Argentina. Es un territorio que pertenece al cordón montañoso de la cordillera de los Andes. Sus restricciones climáticas y distribución de la red hidrográfica limitan las posibilidades para los asentamientos humanos, que se reducen al 3% del territorio provincial, situado en superficies de oasis, o sea que son valles donde es posible la vida. El Valle de Tulum es el oasis de mayor extensión territorial y es allí donde se ubica el área metropolitana de San Juan. Ocupa una superficie de 127 kilómetros cuadrados y posee una población de 494.639 habitantes. Representa el 72,6% de la población provincial. El proceso de expansión y segregación, para entenderlo, es preciso comprender la configuración territorial de San Juan, que se da según una específica ocupación y apropiación del suelo, con formas de reproducción social debido principalmente las posibilidades de desarrollo en torno a la relación con el oasis. Posee limitantes de disponibilidad de suelo apto, agroproductivo y de recurso hídrico. Tiene un clima desértico, gran amplitud térmica, escasa precipitación, y un grado de sismicidad 4, que es el más alto en la República, y restringe las posibilidades de construcción en altura. Sin embargo, esto no es ajeno a diferentes fenómenos de procesos políticos, económicos y sociales de diferentes escalas que intervienen y tienen incidencia en el modelo territorial. También se identifica con procesos de expansión urbana dispersa propios de América Latina, en territorios de interfaz periurbana, periferias pobres que son distantes, con escasa accesibilidad a fuentes de trabajo, bienes, servicios, equipamientos sociales, entre otros. Y esto genera amplios márgenes en los tiempos de viajes y se estimulan sentimientos de exclusión y desarraigo. La expansión urbana en San Juan presenta transformaciones con particularidades en distintos momentos. Sin embargo, su aceleración se dio en los años 90, generada por medio de desarrollos inmobiliarios privados, con gran consumo de suelo con respecto a desarrollos de operatorias públicas, que generalmente rompen con los tejidos tradicionales. En los años 2000, si bien las políticas de vivienda lograron mejorar estas densidades en los procesos de expansión respecto a la década anterior, esta seguía siendo muy baja y más extendida en el territorio. Es posible comprender la expansión urbana, perdón, se me pasó la diapositiva, con sus diferentes grados de consolidación y densidad de la población urbana. Aquí se puede observar en el área central, e incluso la centralidad misma, con densidades bajas en relación a otras áreas periurbanas, donde comienzan a aparecer densidades mayores. En un acercamiento, podemos verificar lo anteriormente dicho, y en palabras de Alfredo Gerais, sobre el proceso de crecimiento urbano, donde identifica 3 momentos, el de expansión, consolidación y por último el de densificación de áreas centrales, es posible observar que actualmente no existe un proceso de densificación en el área central tradicional. Y de esta manera se puede observar que el desarrollo urbano y la expansión avanza independientemente de la existencia de planificación territorial por acción o por omisión de la misma. Es posible debido a que la construcción de infraestructuras permite dirigir el crecimiento urbano, dotando de accesibilidad al territorio a través del transporte y la movilidad, aunque estos se hayan interpretado como asuntos sectoriales. O sea que se entiende a la red como una simple herramienta para satisfacer un servicio demandado por las actividades, y así suponer que no existe adaptabilidad o alteración del comportamiento espacial de los desplazamientos, así como la movilidad no induce a la localización de actividades. Para ello, se aplican métodos basados en la demanda de transporte que remiten a estimaciones de demandas futuras para dimensionar infraestructuras según la lógica tendencial del crecimiento. Para ello existen disciplinas como de la ingeniería civil, ingeniería del tráfico, economía del transporte, haciendo énfasis en aspectos como caudal, flujo, potencia, etc., sin considerar lo que implica la construcción del territorio como un modelo de funcionamiento o de ordenación del sistema. Se consolida así, de esta manera, un desarrollo urbano desigual, según una deficiente planificación territorial, con estas tendencias que no solo generan un aislamiento físico respecto de los sectores funcionales de las ciudades, sino que también se manifiestan territorialmente en términos de segregación socioterritorial, tanto residencial como en las condiciones ambientales que poseen ciertos sectores de la población. Además, habilita distintos procesos como la gentrificación y la fragmentación. Se genera una fuerte presión demográfica sobre el espacio rural. Ya habíamos dicho que el suelo agroproductivo es escaso en la provincia, por eso coarta estas posibilidades a futuro de sostener aprovisionamientos propios de alimentos. En este marco es donde se presenta la red Tulum de transporte público de pasajeros, desde la reestructuración del funcionamiento del sistema para evaluar si colabora o no con la reproducción de un modelo de expansión con la consecuente segregación territorial. Para ello es necesario entonces conocer la red anterior respecto al transporte público de pasajeros, que de forma histórica las empresas prestadoras del servicio de transporte público administraban ciertas áreas, absorbiendo nuevos conjuntos residenciales conforme iba extendiendo sus trazas y manteniendo un formato de cobertura concéntrico. No existía un conflicto en la distribución, se verifica de manera sectorial, siguiendo con la configuración tendencial de la expansión urbana. Y esto se puede sintetizar en distintas cuestiones. El modelo de extensión de las líneas o trazas sobre base de asignación histórica se basa en empresas por sectores. Tiene un carácter radial, convergencia de líneas hacia la centralidad tradicional, grandes distinciones del servicio e infraestructura entre centralidades, áreas periurbanas y periféricas del área metropolitana de San Juan, según recorridos, precios, tiempos en traslados, frecuencias, señalécticas y paradas. Menor cobertura y mayor tiempo en el traslado, cobertura deficiente, inexistente en zonas alejadas, sistema de movilidad era elemental, sin posibilidades de uso de aplicaciones para la programación de un viaje. No prevé situaciones sanitarias críticas, por ejemplo en los sismos, y que exista algún ramal directo hacia las estaciones sanitarias, y tampoco vías o carriles específicos. De esta manera, la nueva red de transporte, la red Tulum, se concibe desde la noción de accesibilidad, y para ello se deben comprender distintas variables que influyen en la generación o no de un viaje. Por ejemplo, la inmovilidad, como tiempos de viajes, recorridos, frecuencias, recursos económicos, discapacidades, restricciones de movilidad, rango etario, género, la inseguridad, condiciones de infraestructura vial o iluminación, entre otras. En este sentido, el sistema de transporte público debía tener una transformación muy grande, comprendiendo un sistema integral para la movilidad social, que amplía la conectividad, pero sobre todo la accesibilidad de la población a diferentes actividades del territorio, anteriormente que no estaban contempladas, principalmente a sectores de educación, salud y recreación. Lo relevante radica en su motivación y el enfoque, ya que no es de corte económico ni basado en modelos de demanda, sino que intenta priorizar los sectores más vulnerables de la población. Los servicios públicos en general, como el transporte público, tienden a ser demasiado costosos en la provisión y sostenimiento a lo largo del tiempo. La relación de oferta y demanda no suele ser positiva, dada que recorren muchos kilómetros para pocos pasajeros. Como referencia, el índice de pasajeros por kilómetro en Cava, que es la ciudad autónoma de Buenos Aires, la centralidad máxima de la Argentina, es algo de 9 pasajeros, mientras que en San Juan, con la red Tulum, la línea que mejor funciona ronda los 2,4 pasajeros y la peor 0,7. De esta manera, y considerando los subsidios al transporte, se buscó profundizar en un servicio orientado al desarrollo urbano, fortaleciendo distintas centralidades que consta no solo de una redefinición de recorridos, de líneas, sino de infraestructura a distinta escala localizada en el territorio. Estaciones de transbordo, cartelería, paradas, entre otros. Más del 30% de las personas en abril del 2020 generaban transbordos en el centro urbano para dirigirse a otra localidad. Y esto tiene que ver con la definición del recorrido de líneas de forma histórica concéntrica. De esta manera, el sistema de transporte público incorpora modificaciones estructurales e interdepartamentales, sintetizadas en las siguientes características. Es un sistema integral que se traspasa de una red centralizada a una descentralizada, generando trazas periféricas, sin necesidad de pasar por el centro, mayor cobertura de servicio, cuenta con una red primaria, una secundaria y redes troncales con estaciones de transbordo, vías exclusivas, paradas más modernas y seguras, conexiones más directas entre departamentos, busca mejorar la conectividad y accesibilidad a zonas de educación, salud y recreativas, busca consolidar pequeñas centralidades urbanas como motor de desarrollo territorial, y se implementa la app que permite planificar viajes a través de Movit. Incluye también un diferencial de tarifas y un sistema sostenible basado en energías renovables con buses eléctricos principalmente. De esta manera, es posible ver la distribución de las líneas en estas figuras acorde al modelo que se presentó anteriormente, que es de corte axial con conexiones perimetrales. Pero más allá de las características propias del sistema, es importante entender que se llevó a cabo gracias a que existieron condiciones favorables para ello, como hitos claves, y que entre ellos se destacan que el vencimiento de los pliegos de la licitación del transporte público generalmente se actualizan cada 10 años, con una posibilidad de prórroga a los 5, y esto ya había alcanzado los 15 años. El sistema de transporte se limitaba a esta extensión de líneas conforme se anexaban a barrios, a la trama urbana, que no ofrecían respuesta tampoco a los reclamos. Había una deficiencia generalizada en el servicio, incluso en distancias cortas y centrales, con grandes demandas de tiempo. Existe una clara voluntad política de implementación y actualización de la red de transporte público. Existen subsidios al transporte en todo el territorio argentino. Hubo libertad en el diseño sin imposición de acuerdos o negociaciones para el beneficio de algún sector empresarial. Y algo particular es que el ministro del Transporte es arquitecto y tiene una fuerte impronta académica en planificación, con una formación eminentemente social. En la siguiente vemos una imagen de lo que es la estación, una de las estaciones de transbordo. Pasamos al proceso de implementación, donde lo importante radica en que no fue basado en otros modelos de otras ciudades, ni modelos de demanda de corte ingenieril. Fue un estudio particularizado para la provincia, con técnicos propios. En julio del 2020 se lanzó la licitación, la cual fue muy criticada por las empresas, y la misma propició una competencia entre empresas considerando los límites jurisdiccionales. Luego se digitalizaron las líneas, las paradas, se contrató Movit y se trabajó en la carga de datos, se generó todo, la completa red de diseño gráfico, se consideró en el diseño personas con restricciones de movilidad, se generó la disposición de estaciones de transporte que tuvieron que salvar implicancias con diferentes organismos, porque hubieron discusiones con infraestructura, vialidad provincial, patrimonio, hubieron instancias de revisión una vez implementado el sistema con gobiernos locales, y se generó la creación de un consejo comunitario basado en un antecedente rosarino que busca justamente hablar de movilidad en los contextos barriales.
Luisa, te quedan 5 minutos.
También que no hubo una relación con la Dirección de Planeamiento de Desarrollo Urbano en la gestación del proyecto, y esto es una contra, que existe un reclamo por ello. Y en términos generales, se expresa que el proyecto falló o faltó en su maduración a la hora de su implementación, pero no obstante se pudo concretar. Hay que tener en cuenta que el momento de implementación fue clave, que tuvo una aceptación y un desarrollo positivo. La demanda del transporte público se mantuvo respecto a la del 2019, y hubo un proceso de adaptación con evaluaciones respecto de quejas de los primeros 8 meses, y la imagen del servicio mejoró positivamente. Hay que recordar que esto fue un cambio total de sistema, y de repente hubieron resultados positivos, ya que las empresas renovaron su parque automotor en esta competencia que se nombró anteriormente, y el 80% de la flota es nueva, convirtiéndose en la provincia con mayor cantidad de unidades nuevas a nivel nacional. Existieron, por supuesto, disputas entre el uso del suelo y las valoraciones inmobiliarias, las plusvalías generadas, pero en la modificación de las trazas, por ejemplo, en la zona central, permitió redefinir usos para revitalizar áreas poco funcionales y el fortalecimiento de centralidades emergentes. Esto está relacionado al plan urbano que tuvo en el 44 la provincia de San Juan, donde la gran sectorización en funciones genera zonas muertas o zonas poco concurridas en grandes periodos de tiempo. Se verifica así también la amplitud de la cobertura con el servicio anterior. No existen zonas sin conexión, excepto algunos sectores de localidades limítrofes. Existen quejas que remiten principalmente a los cambios de hábitos con el servicio, y en síntesis el sistema prioriza un equilibrio para la democratización del acceso en búsqueda de mejores condiciones para la mayoría de la población. Las futuras proyecciones de objetivos para la red Tulum se expresa también la existencia de proyectos de financiamiento desde Nación para buses eléctricos y desde el exterior con la Embajada de Londres para mejorar cuestiones técnicas, si bien existen buses eléctricos y una planta que justamente es el parque Achipurac solar, donde se cargan los vehículos, hay una proyección para mejorar todo el servicio. Se está trabajando en un plan de movilidad sostenible con financiamiento de la Unión Europea, y en el cual también se ha convocado ante esta falencia de no comunicación con la Dirección de Planeamiento y Desarrollo Urbano para que acompañe la propuesta de desarrollo. No se han generado indicadores de evaluación y monitoreo, no obstante se entiende la importancia de los mismos. Por eso, junto al Ministerio Nacional de Transporte, se está trabajando en capacitaciones que van en esa línea, además de vínculos con universidades nacionales para instalar y discutir estos temas en la agenda local y regional, para tener una visión global necesaria del funcionamiento del sistema urbano. Y por último, como consideraciones finales, se ha vuelto un caso de estudio de relevancia a nivel nacional por ser un caso exitoso de reestructuración integral, ya que posee un enfoque de integración social y configuración desde las características propias de la provincia. Existió separación de ámbitos que se interdefinen territorialmente, como la planificación urbana y el transporte. Los tiempos de planificación exceden a los de la política, y los cambios de gobierno inhabilitan que las propuestas posean continuidad. Por ello se justifica de cierta medida que esta política de transporte se haya implantado de esta manera, aunque puede colaborar con procesos de segregación en la medida de que no se generen consideraciones o restricciones para las áreas de expansión urbana. La alteración del funcionamiento del conjunto permite nuevas valoraciones de centralidad o marginalidad, pero al ser reciente no es posible tener la certeza sobre la variación del proceso de segregación en áreas periurbanas, aunque sí es viable o visible poder integrar a gran parte de la población excluida, lo que mejora las posibilidades de movilidad. Bueno, he ido lo más rápido posible porque no tengo constancia del tiempo. Desde ya, muchas gracias.
Thanks, Luisa, for this great presentation. We will jump into the second presentation. As I said before, we will have a space at the end for the comments of Jorge and also from the other attendees. So our second presentation is in charge of Júlio Celso Vargas from the Federal University of Rio Grande do Sul, and also Ben Spencer from Oxford Brookes University in the UK. So the stage is yours. I will let you know again when you have 5 minutes left.
Do I have to share my screen? Is it?
Yeah, yes, please.
Okay, please tell me if you see it.
Yeah, perfect.
Okay, I'm sorry for being looking to the right side because of my screen. So if you allow me a brief first minute of Spanish speaking or portuñol para cumprimentar los colegas e participantes. Para mim é um prazer estar aqui. Muito bom retomar o contato com pesquisadores, professores, estudiosos e práticos aqui da América Latina, por este caminho longo, passando pelo norte global. Gostaria de dizer também que semana passada estivemos presentes num evento de becas de doutorado da rede Arquisur. Então, um pequeno comentário quando conheci a cidade de San Juan em detalhe, com uma apresentação muito interessante sobre a cidade e esse conceito de oásis e as suas características peculiares. E também é um prazer ver colegas da Universidade de la República do Uruguai, com quem tivemos contato durante muito tempo aqui no Rio Grande do Sul. Gostaríamos de reestabelecer. Então, muito obrigado, e eu vou começar a apresentação, então, falando em inglês. Well, this paper or this presentation is called Staging Active Travel in Brazil, a View from the Street. So we are presenting it in this 5th panel of this very interesting, prestigious seminar series. I am the author, together with Professor Ben Spencer, Dr. Ben Spencer, and Dr. Tim Jones from Oxford Brookes University. And then we start by saying that this work responds to the accessibility turn in Latin America call by applying critical mobility thinking to active travel in Brazil. We are adopting Ole Jensen's staging mobilities approach to investigate from the ground up the cultural, social, and material conditions under which active travel is performed and how this conditions their practice. So we are applying Jensen's framework, the idea of staging mobilities, with the aim to reveal how active travel is staged from above and how it is choreographed within and beyond the neighborhood from below. We demonstrate how supplementing the hard observational data of movements between origins and destinations with information garnered from a situated approach to understanding accessibility and active travel could help decision makers in the Global South develop more effective policies to support and promote active travel. I hope, but I'm not so hopeful as I used to be. Well, so the presentation is structured with this brief introduction. Then we are going to talk about a bit our theoretical lens, and then move on to the staging active travel from above and from below in our city and this specific neighborhood in Porto Alegre, the Great Cruzeiro region. And then we're going to conclude with some remarks and acknowledgements. So this is the main picture that synthesizes Jensen's idea of staging mobilities, the idea of mobilities in situ that articulates the from above component, the planning, regulations, the government, institutions, and the technical superstructure, and then the from below component where social interactions and embodied performances take place. So Jensen says that mobilities do not just happen or simply take place. They are carefully and meticulously designed, planned, and staged from above. However, they are equally important, acted out, performed, and lived as people are staging themselves from below. So staging mobilities explores this dynamic process between being staged and the mobile staging of interacting individuals. Then we put this picture as from the Cruzeiro neighborhood, trying to ground up and to bring down these ideas to our context. There's a road construction in the center of a place that clashes slum-like neighborhood with the formal city. And then this is the from above, let's say, image. And then people are staging their mobilities from below in the lower part of the image. So a very brief set of numbers and a very concise timeline of the idea of Brazilian structure of accessibility and slash mobility. We have since the 70s, the military dictatorship, the idea of a great Brazil, road constructions, etc. And then we can put Curitiba, the famous city, as part of an innovative idea, but not so much because they were part of this technocratic, not democratic way of building city, experimenting with cities. And then we have the redemocratization, the Workers' Party, Lula in Porto Alegre, and it was the seed, the first, let's say, the kickoff of a new wave of urban planning in Brazil. And then Porto Alegre became famous because of the World Social Forum, and our former mayor went to the capital to be the Ministry of Cities of Lula. And then they started an unprecedented urban policies and nationwide plan making campaign. And then by the 2008, we had the financial crash and the Minha Casa Minha Vida housing program, which was a way to promote real estate revival at the same time as supplying housing for low-income communities. And then the 2010s with the mega events and the protests and the spring, and then the coup d'etat that turned down President Dilma Rousseff. We like to call it the Empire Strikes Back, as it always do. And then specifically in Porto Alegre, we can say briefly that it was a city that was pioneer in terms of building bus lanes and then cycle lanes by the 70s and 80s. And we have this, let's say, golden era of the city in the 90s and the beginning of the 2000s. And then when the city got again in the hands of the conservative forces, because the empire always strikes back, we have a new wave of plans and regulation, a bicycle master plan, a pedestrian statute, this micro accessibility master plan, and blah, 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 because we are very good in producing laws and plans, but we don't like that much to follow them, to obey the laws and the plans. So we are very fruitful in terms of many, many written dead things. Let's put it that way. So briefly, in Porto Alegre, we have this roughly 40-30-30 modal split, public transportation, active modes, and the car. This is an average between many research and surveys, because the last formal origin destination full city research was made in 2003, almost 20 years ago. So these other organs and NGOs, etc., they are always trying to update these figures, but we never come to a final decision, let's say. And we have this very interesting graph of increasing motorized fleet, mainly the particular cars, and this decreasing bus usage as a phenomenon that you all probably know, accelerated by the ride-hailing, companies and the pandemic. And we have these measures of access to opportunities, taking advantage of Rafael Pereira R code to exhaustively measure all types of cumulative opportunities, minimum travel times, etc., for the whole city, for all types of places, opportunities, activities, jobs, shopping centers, parks, schools, etc. So I highlighted our Cruzeiro community as a way to show how it is very central in terms of proximity to the city core, but at the same time, it's kind of segregated and separated from the city. So it has very low figures of percentage of opportunities accessible by public transport, bike, and walk. But then we go zooming inside the community. It's kind of an archipelago, a series of patches of formal and informal, urban, big boxes, things like that, and green preserved areas. So this is a very nice drawing from a resident, showing how it is disconnected from the formal city, and also inside of it, it's made of separated small parts. And the social demographic data, mainly Black people with low degree of education, with problems of health, criminality, low income, low human development indexes. And this striking image that shows how patches are just juxtaposed. We have formal rich people, we have this health unit, we have the road construction and the strip of favelas, and then the green area. It's crazy. Mobility figures inside the community, very low degree of mobility. People are pretty much immobile. They stay at home and they walk a bit, take a bus from time to time. They don't go to parks and plazas, and they have serious health issues. And we again measured this physical accessibility in terms of connectivity, accessibility, physical centralities, etc., and public transport supply. Then we opened this box to tell a bit about this road construction, which was promised for the World Cup 2014. They first destroyed the place, evicted people, and then they thought about starting the roadworks. And then you can see the promises, the beautiful images, and the idea of connecting the football stadium and a new part of the city. And we see the mayor and the other officials, just like directors, setting up the scene, building the stage. But we know that this accessibility is for motorized vehicles, mainly for providing access to condos, the football stadium, and shopping centers, and this new, very rich-oriented development. So people from the community, since the beginning, start wondering and start concluding that that's not a project for them. And then we move up to the from below component, first looking at the landscape and this awful shame wall that divides the formal and the informal part of the community. And I'm going through briefly some participants' quotes that we garnered from this go-along approach, this mobile methods. We first build trust and get into the community and make a real approach of, let's say, a bit of co-creation in order to really navigate the space with them, to talk with them, to feel together with them, to interact with spaces, material infrastructure, with people, and to understand and to even share these embodied performances, the bodily sensations, and to discuss a bit about the politics of mobility. So we have several cases. I'm not going exhaustively through them. An old woman that take children to school, the other one, which is a nurse that heals people, but it's full of health conditions because she has to walk uphill, and she always talk about the climate, the environment, the night and day, rain, etc. This is.
You have 5 minutes left.
Okay, I'm just concluding. This woman, it's a very interesting case, how she dressed up and how she performed in the space to go pick up his son at the bus stop in the middle of the night, and how she negotiates with the drug dealers to gain access to places. Then we went to an interview and live, let's say, with young people to understand their mobilities. This guy who take buses always complain about the quality of the bus, the idea of getting rid of the public transportation. And then the young people that cycle and their fight against the car, their daring of bicycle at night in the middle of the road. And then 3 slides about these red ones, just to talk a bit about how people interact and negotiate space and use the streets, and how young people are getting empowered and enlargement of mentality, education, because they make contact with other groups of young people outside the favela, and how they grow with it. The idea of contest, this reservation of space for cars, and at the same time they do have squares or leisure areas. And we are finished with this manifesto. We kind of provoke, so people put these cartels in this invisible square. To conclude, Ignacio, in a minute, so being there and seeing there, can we get close to the mobile experience without being present? Jensen's theory is an heuristic, basically, that relies on the utility of this mobile methods approach to understand the complexities of everyday life within this specific context in Brazil or Latin America. Traditional transport studies and transport geography have this quantification tradition, and the classic social research methods will slow down and freeze experience. So we took advantage of contemporary mobility studies, concepts, and the walking cycling interview, this go along, to research and represent mobile experiences and to capture them where context may be crucial to understand the significance of the event to the participant. To conclude, we can start, it's a challenge to start relating the idea of staging mobilities and the mobilities turn, the new mobilities paradigm, with this accessibility turn you are proposing in urban research. We can start by saying that it was precisely this situated approach using Jensen's loose framework that allow us to understand precisely the complexity of the needs and abilities of different immobile bodies over and above simple transport geography notions of accessibility, measuring lots of things. So to polish the lens, we know that we need to, it's not a panacea. We have to incorporate feedbacks, the idea of co-creation and contestation we ourselves are using, but it's not present in the theory, etc. And then basically some acknowledgements of this project that finished in 2019, and an homage to the community leader that passed away from COVID in 2020, which was a friend of ours and a very important agent in Porto Alegre. Thank you very much. That's it. I'm sorry for the delay.
Oh, it was just in time. Thanks, Júlio, for a very, very interesting presentation. We will move to our last presentation of the session. It will be in charge of Juan David Franco from the Secretaría de Movilidad in Bogotá and Natalia Villamizar from Newcastle University. It will be presenting about access to public transport for elderly citizens with a case study in Colombia and Belo Horizonte. You have 20 minutes. I will let you know when you have 5 as the other presentations.
Okay, thank you so much. I am Natalia Villamizar Duarte. My colleague Juan David should be joining us in a minute. If he cannot join, then I will continue and complete the entire presentation. I'm going to start presenting our research about elderly citizens' access to mobility in Belo Horizonte and Bogotá. We have been working on this research with Marcela, Ardila, and Ana Paula Vasconcelos from Universidad Federal de Minas Gerais in Brazil. And I want to especially thanks to Rafael Reis, who has been supporting us greatly running the content analysis in Iramotec. So why are we interested in elderly access to mobility? Well, we are all getting old. That's a reality. And it's happening worldwide. We're witnessing increasingly aging societies with larger percentage of population of older people in cities as well and in other communities are participating in urban life. Such demographic transformation has an important impact on the demand for public goods and infrastructures. And as we know, mobility plays a key role in shaping the access to such public goods and other urban opportunities. So it is important to understand how mobility is, how urban policies understand that these diverse mobility practices and how they include the needs and demands of diverse groups of population, especially those that are more vulnerable, such as elderly. We live in an increasingly aging society where elderly are one of the groups whose mobility demands are less understood and less incorporated in urban and transport and mobility policies. So we argue that this happens because elderly populations are largely conceived as from a perspective of immobility, does not really match their needs and practices. So we want to explore these arguments through 2 different aims. The first one is to characterize the elderly practices of mobilities and their demands for accessibility. And the second one is to examine how elderly accessibility is understood and incorporated between urban policy at local level. The next one. We favor a comparative approach because it allows us to understand what is the role of mobility, allow us to understand how mobility is conceived in a kind of universally as an important and key aspect of access to urban services. The local responses may be different. So in every city, like that general idea that we need to ensure conditions of accessibility and certain aspects of mobility, while that idea is universal, we kind of generalize, the way that it's implemented, it's different in every city. This is important because it tells you a little bit more about how certain groups have different agencies and are able to kind of influence the public policy and put their demands and needs into this like negotiation of the policy. In different places, it depends on the agency of the populations, but also it depends on how the policy structure and the policy making structure and the social construction of policies understands those different groups. So we're going to compare Bogotá and Belo Horizonte. We think that these two cities, it's a good example. We know the cities are different size, the cities are pretty different in population, but the two cities have been engaged in an important effort to improve their mobility infrastructures and to change their mobility kind of their approach to public transport and mobility. Anna, the next one. So what we have found in the literature is there's a great diversity of elderly people displacement practices that tell us that we need to challenge that idea of homogenization view of age. So when we talk about elderly, not all the elderly are the same. Like just depending on the moment of the elderly cycle they will have different demands, but also there are differences regarding their conditions of disability or not disability, how they are inserted in the work life, etc. So that diversity reveals that there's a relational character of mobility of the elderly, which it's really important to understand from the point of view of what are the access they have to organization of transport systems, how they are the conditions of proximity, etc. So like we see that even organizations like the WHO are now talking about the importance of creating everyday more age-friendly world because the cities are not taught for elderly people. So there's a recognition in the literature about how we need to move from understanding this the elderly population as an homogeneous group, but also understanding that what we think is that this is not necessarily being recognized in terms of policy. Anna, the next one. So what we decided to do is with this comparative perspective, we're gonna sorry, I have the light in my face. Well, but through this comparative perspective, we're gonna look to characterize the practices of mobility of the elderly. We decided to do a quantitative analysis, which is a descriptive statistic travel behavior, and a content analysis of the policies that is basically a discursive textual analysis and a hierarchical classification. So for Bogotá, we have 38 different public policy instruments. 13 were more related to social policy that are about elderly population, and 25 were territorial policies. In these 38 documents, we coded, we found 258 semantic units. In Belo Horizonte, we have 31 documents, 12 of them social policies, 19 of them territorial policies, and we had a total of 506 semantic units. Each semantic unit is part of the document where the key codes that are related to elderly were were included in that semantic unit. For the two cities, we have the quantitative analysis of travel behavior, the descriptive statistics and travel behavior. We use the household survey 2011 for Bogotá, 2012 for Belo Horizonte. There's a mistake in the slide, but it was 2012, if I'm not wrong. Bogotá has a more like a recent household travel survey. We decided to use the 2011 because Belo Horizonte has not updated its survey. So to make this more like to make the comparison more like real, we decided to use similar years. So this is how we analyze the travel behavior. You see, we saw the household model, the trip model, the people model, and then just run the descriptive statistics about it. I'm not sure if Juan, well, I think Juan is not joining us, so I will continue. What we found is like what we will expect because of the policies think about the elderly as not mobile. Then we were thinking that the number of trips will decrease with age. And we saw that that is true in Belo Horizonte, but it is not the case in Bogotá. And in fact, this number of trips goes up. We're looking here, sorry, I forgot to say, we're looking at the characterization is on people that is over 60 years old in the two cities. We think that it's necessary to go in depth and understand what are the difference in these two cities in terms of access to work, because that may be one of the reasons why in Belo Horizonte it is decreasing, but in Bogotá it is actually the number of trips goes up. So we also observed there is a difference in terms of gender that is more visible in Bogotá than in Minas Gerais. I have to say that this is our preliminary data. We just started getting these results, so we still need to go a little bit more in depth and try to understand what are those differences that will explain this data. Anna. In terms of the reasons for traveling, we need to go and let's say that, sorry, to understand what are the different reasons, because in many cases we believe that there should be care motivations that are based on care, because elderly, at least in the case of Bogotá, are in many cases support the family for child care, etc. The next one, Anna. And then in terms of gender, we have found that in Bogotá, the women travel way more than men. That in Bogotá, women travel more than in Belo Horizonte, but they also travel in a more sustainable modes, basically they walk more and they use more public transportation, while in Belo Horizonte there's there's a more use of private car. This is not really different from other age groups. The fact that women walk more is something that the literature have shown, so that's not particularly different from other groups, but it's something we will be able to compare later in our research. Anna. Regarding content analysis, we did this exercise of hierarchical classification, which is basically using, it's a relational, the software relates the terms that are closer to each other, and it tells us which terms are more related in terms of the different semantic units that we decided. If you go to the next one. So if we think about all the policy instruments that we coded, in both cities, there is an emphasis in urban and regional planning and in policies, in urban and regional planning and in policies that are mostly oriented to providing facilities, but these facilities are more like for care facilities. Most of the regulations are associated to special issues for buildings and conditions for geriatric services. And when we think about policies for elderly mobility, what we find is like there's a perspective of mobility. So policies, when the policies talk about elderly, they focus on access to health and care and services and care services and on like retirement plans. And elderly mobility is marginal in public policy in general. This is more true in the case of Bogotá. In contrast, in Belo Horizonte, elderly mobility is becoming visible as a public problem in the recent decades. This could be attributed to the recognition of elderly mobility as a social right, which has been framed in the idea of the right to the city that has been part of the transformation of urban policy that Brazil has has engaged in different cities. There are other norms that most of other norms consider or refer to universal design public spaces, and they focus on disabled people, but they actually tend to include elderly and homogenized elderly with disabled people. In Belo Horizonte, transport is more integrated to social policies than in Bogotá, and this is for what I say, particularly related to the idea of mobility as a social right, and the key aspect of providing equality conditions for vulnerable groups. In Bogotá, transport policies are articulated, better articulated with territorial planning, but the elderly are not considered necessarily in that relationship. So the policies related to elderly are more specialized policies of social policies, and they are more refer more to protection and health. The next one. If we look only at social policies instead of all the group as a whole, we found that that notion of the elderly as vulnerable population is based on the idea that they are sick and they are dependent. Which is basically a notion that is paternalistic in the sense that they don't recognize what they can contribute to society, or what could be or what continues to be a contribution to society in terms of not only their capacity to be productive, but the capacity to be integrated into the urban life. Also, the policies don't recognize diversity of elderly situations. As I mentioned before, literature has shown that being old is not being old the same, being old at 50, at 60, that being old at 90. That recognition of the diversity of elderly situations is not considered. It also, policy doesn't consider the vinculation of elderly to labor markets, and either diversity of health conditions, which is what is closer when you look at it from terms of care, but and income. There are different between two cities in terms of the promotion of autonomy. In Brazil, elderly are seen as a more autonomous subjects, individuals, but in Colombia, there's still this paternalistic view of the elderly.
Natalia, you have 5 minutes left.
Perfect. So if you go to the next one, in terms of accessibility and mobility policies, territorial policies in general, in Belo Horizonte, this integration between social and territorial policy, which is they have gone farther than in Bogotá, particularly between accessibility policies. There's a more real relation between the fare of transport and the access to different services and infrastructures. Transport is included as a social right. As I said before, mobility is considered a social right. So it's not only about like subsidizing and creating like free access to transportation, but also the fact that it's considered a social right means that the elderly population have like a space for public debate, and they have an important, they have a lot of agency for like influencing policy. In Bogotá, because of the social aspects are not included, like are not linked to territorial policies, still the territorial policies see the elderly just as one more of the vulnerable groups, with this focus on universal design. There's some attempts to start reducing the fare to make public transportation more accessible to elderly, but there's no such a clear link, and mobility is not presented, at least for elderly, as a right. And the agency of the elderly population is, of course, less. So, because what we have found is in both cities, elders show similar tendencies in terms of diversity of purpose and privilege of public transport and active mobility, that inequality is observed in terms of gender and age, that policies respond to the idea of immobility because they see the elderly as vulnerable and outside of the productive life. But there is definitely difference in Belo Horizonte. Well, the elderly has been more active in terms of influencing policy, and this is because like mobility is considered a social right. There is like not a lot of important improvement physical access to public transportation of facilities or that facilitate active mobility in either of the in the cities. There is a huge so there's the policy doesn't recognize the difference between different groups of elderly. The policy tends to homogenize to pair the elderly with disabled people. But even though that is like kind of, we saw that in the two cities, Belo Horizonte, it's like kind of shifting that vision, but it's because the elderly have more capacity to intervene in policymaking. And this is where we are right now. Thank you so much. Well, any questions or comments are welcome.
Thank you, Natalia. Great presentation as well. So we will have a space right now for Jorge's comments about all the presentations, and then we will open the space for everyone here, all the attendees. I already seen some questions on the chat, so we can take those ones after Jorge's comment.
Well, sorry for my English, it's very bad, but I try to make me understand. I want to thank the presentators, the three papers, because they were very interesting, stimulating, and provocative in the sense that they are questioning how we focus on transport and mobility questions, and what are the relationship between planning and social practices, and what are the relations between what is conceived about the city, the different territorial context, and what are the results of that practices. I think that there are particular aspects in each of the presentation that we can talk about, but there are also some points in common that we can emphasize to try to link the three presentations. I'd like to set some starting points that I think that are common in the three works. The first one is that from the point of view of Latin American cities, socio-spatial inequalities is a starting point. When we are talking about how to design a bus network, when we are talking about how to improve accessibility of a neighborhood, and when we talk about how are we trying to understand the mobility of elderly people, in the social inequalities are part of the core of the problem. So I think it's a strong nucleus to consider in each of the presentation. The second one is that mobility is essentially about people. We can say that it's a more complex than that, that it's a kind of combination of people, infrastructure, spaces, regulations, institutions, technologies, but people is in the center of the mobility. So that is also a model that is connecting the three presentations. In the first case, in the case of San Juan, I want to emphasize that there are some articulations and tensions between urbanization models and mobility models. When we hear about how are the expansion process in the city or densification process in the cities, we have also to ask about how is related mobility with the kind of urban area that we are analyzing. So I think that it's a central point, the relation between urbanization and mobility models, especially in these urban expansion models with low density, discontinuity, high land consumption, and also with environmental conflicts. Also in the first of the three presentation that we have heard, I think there is a tension between urban planning and transport planning, a kind of tension that we can also recognize in the last presentation through the discourse analysis, that the connection between planning and urban planning and transport planning. And in that case, I think it's also important to think about policy ecosystem, the group of territorial policies, social policies that are articulated in a mobility problem. One question that is very interesting in the first work is how to build new transport networks to meet diverse mobilities, considering multiple demands in different contexts. So I've seen that it's a kind of challenge to think about a new transport network, especially when we can decide a network analyzing the different aspects of the city that could be quantified, but we can also consider the social practices. In some cases that have been implemented different transport network, we have seen a lot of problem with the appropriation of the population of that new networks. And we have seen that it was necessary different kinds of connection, articulation with communities to explain, to to listen to the needs of the communities before and during the implementation of a new transport network. It is usually a planning that is more based on technical aspects of the networks and not so interested or not so emphasizing the perception of the population. That connection between the structural vision and the vision of the subjects is also intention in the second paper that we have shared today. I think it's very interesting that approach that try to connect from above and from below to understand the relationship between the context of planning and the real appropriation of the city by the popular communities. It's usually very very disappointed to see how communities that are apparently located very close to city centers have a level of accessibility very low, and that low accessibility is crucial to access to other rights for the population that live in that kind of neighborhood. We have seen some pictures where the inequalities are clearly expressed in the city through the houses and that different economic level that we have seen in the case of Porto Alegre. It's also a very interesting point in that work that ask for the accessibility in different levels. How is the relationship between the accessibility of proximity and a metropolitan scale? So I think that is also a tension in the mobility planning that can be considered. We emphasize in some cases that it's ideal to mobility of proximity, but in some neighborhoods that mobility of proximity may be a kind of enclosure in an area that where most of the people can't find everything they need for a social life. So how to get this kind of combination between proximity and metropolitan scale may be a point of discussion. A discussion that is raised from the second presentation. And in the case of the third one, there's also inequality, social inequality in the center of the presentation that can be considered. I think it was very interesting how the others reason for traveling were the main, and it raised the question that if the networks are adapted for that kind of other reasons, considering that in most of the cases the transport networks are designed to meet the needs for access to travel or for studies. So that kind of other purposes of the trip may be challenging the design of the networks, and also the adaptation of the public space to walk and to get in the proximity the response for their needs. I found interesting that this is a kind of mobility that is not so explored. There are not so many works that about elderly mobility, but I was thinking when hearing Natalia how we can complement this statistical analysis, this quantitative analysis, where the perception of the people that is in that kind of situation. I think that is a first step to make visible the problem of elderly people in their daily moving, but we need to understand reason, strategies, fears, possibilities, needs in a kind of complementary methodology to reconstruct the whole issue about elderly mobility. So those are some question that rises from the words we have heard today. I think there is a good material for our interest in interchange between us around those presentations. Thank you.
Thanks, Jorge, for connecting the presentations and for making these very interesting reflections around that. We'll have over half an hour for discussion now, so we have plenty of time. I encourage you to make some questions in the chat, or if you want to raise a hand and do it like out loud, it's fine as well. Maybe to start, we can like come back to the presenters and like, I don't know if you want to add something in terms of like Jorge's comments, some questions that he arised in his comments as well. So whoever wants to start, it's fine.
Ben, would you like to say something?
Yes.
From above.
Júlio. So yes, I was struck by those connections between the presentations, and thank you for your summary, George. I think particularly the Natalia, your presentation, it seemed to absolutely lead itself towards the sorts of approaches that we'd used with trying to get a more personal, detailed view of people's experiences, to explore some of those issues about what was meant by that other category, and also the reasons why there was an increase in numbers of trips in Bogotá, which looks so fascinating and goes against a lot of the literature. I think just to say a bit more about our presentation, I think we've got a kind of, as Júlio was saying, a kind of heuristic which tries to bring together the sorts of things that you mentioned, George, with that combination of all of the different elements and how they're focused on people at an individual level, but also that social dimension being so important as well. And we're keen to explore the kind of usefulness of that as a framework. One of the things that we were trying to do with the mobile methods was to explore their suitability in different contexts. And so I had the experience of using them previously in Oxford, and then they were used in Porto Alegre and a couple of other cities in the project, and so there were very different experiences. And one of the things that Júlio mentioned in passing was the importance of that, of the trust and being kind of embedded within the community. We used a variety of different methods, and that was, I think, really important for the success. The other thing that struck me, Júlio, when you were talking, you talked about the kind of theoretical model, which comes from a kind of Danish, an academic in Denmark, from a very design orientation, and he talked about the meticulous planning of the urban realm, and that seemed to be in huge contrast to the actual experience of the urban realm. Possibly slightly different in Denmark, and certainly difference between Denmark and the UK, where we were doing our work. So yeah, that's just some additional reflections there. Thank you.
Yeah, thanks, Ben. That's great. Natalia or Luisa, you want to add something on Jorge's comments?
Sorry, Anna, I think Anna was, there's some really interesting questions that Alexandra is asking us, and Anna would like to go ahead and answer them.
I'm gonna try to answer with my English, but okay. We want to highlight that elderly people are very diverse in their trips, in their motives, in the purpose. And this is very interesting, but because finally the policy doesn't understand the diversity. On the contrary, the policy addressed the effort to improve urban facilities, our houses for elderly people, or those kind of infrastructure. And we can see that elderly people demand for better accessibility to the bus, accessibility to the spaces, accessibility in terms of economical subsidies, like fares, free-fare and low fares. And this is very important, because when we compare both cities, at the end we see that the elderly people travel a lot for working. And this is for something that we have to check, especially when we compare Europe, US, or African or Latin American context. Our elderly work a lot, and they have to go to earn their lives, and they have to travel for that. And this category of others are very interesting too, because when you see the research, we don't know exactly what kind of trip they do, but we know that this kind of situation could be very diverse, like go to church, go to the supermarket, go to care someone. It's not like this typical travel for health that the policy is usually oriented. That's why we consider that it's important to know the reasons why they travel. We are exploring other variables, but we are creating a model for that, and it's very difficult because we are trying to create multi-criteria methods, like cluster analysis, in order to know, or classification in order to know, but we don't know yet, and we are trying to do for the paper a better analysis in that sense. I was thinking about the social inequality that Jorge, I was saying in Portuguese, Jorge, sorry, Jorge was talking about, because we can clearly see difference between Belo Horizonte and Bogotá, and we see Bogotá is a very unequal city, that people work more, elderly people work more, and they go outside and travel more than Belo Horizonte, people from Belo Horizonte. And at the end, because Belo Horizonte is a classic model, if you see, but Bogotá is not. And then this is nice for comparison. I don't know if Natalia wants to say.
Yeah, I
more.
just wanted to add that like we see that a lot of when you do policy analysis from the mobility perspective, a lot of the analysis is focused on understanding the policy as a kind of a fixed given thing. And what we want to do, and this comparing the policies, Alexandra, and you ask, is by comparing policies with the practices, is because we understand policy as a social construction. And if you see what is more interesting about this case is like policy doesn't happen alone. It's not there, and doesn't grow like from nowhere. It's people that it has an agency and is able to influence that policy. What at the end, it's like shaping how that policy responds to demands and needs. And what we find really interesting is like the policy in Belo Horizonte, it's been like influenced largely by the population, elderly population. Well, but the elderly population is not like the one that has mass mobility. In Bogotá is the other case. The elderly population has more like there's more registered mobility. I'm not saying that people in Belo Horizonte don't move. It's like what the data we have is that people in Bogotá move or are more mobile, elderly people, than in Belo Horizonte, but they don't have the same agency. They definitely don't have the same capacity to influence policy, so their needs and demands are not being like visible, at this moment. So we want to understand, we understand like mobility, like how the policy is a product of this capacity of agency of certain populations, then we'll be able to understand that relationship. That's it.
Thanks, Natalia. I don't know, Luisa, if you want to add something, it could be in Spanish as well, no problem at all.
Primero que nada, muchísimas gracias. Disculpen que no me animo a hablar en inglés, la verdad que no tengo muy buen inglés hablado. Lo único que quería resaltar es que me parecieron súper interesantes las otras presentaciones, y creo que me faltó decir en la presentación que San Juan ha sido un ámbito de experimentación desde la planificación en su momento, porque sufrió un terremoto en el año 44, en 1944, devastó toda la ciudad y se aplicaron las lógicas del zoning con los postulados del CIAM. Por lo tanto, es particular la red de transporte en este sentido, ya que si bien existe la centralidad tradicional, las áreas institucionales que comportan gran parte de la ciudad queda totalmente, y áreas centrales destinadas a comercio, a partir de la 1 de la tarde hasta, porque el funcionamiento también difiere de muchas de las ciudades argentinas, incluso de otros países, y queda totalmente desolado. Entonces el funcionamiento, al no existir movilidad de personas en el ámbito central, desde la 1 de la tarde hasta las 4, y a partir de las 9 de la noche hasta las 7 de la mañana del otro día, confiere a la ciudad otros parámetros de inseguridad, áreas que son principales totalmente vacías. Entonces eso logró con esta nueva red poder revitalizar y generar otras valoraciones de suelos con nuevas oportunidades para la localización de usos. O sea, no hubo en sí mismo una relación con el Departamento de Planificación Urbana y Desarrollo Urbano. Pero nosotros desde el área de investigación nos cuestionamos principalmente en qué medida, desde el deber ser, que tiene que haber una conexión entre la planificación urbana y la planificación del transporte, en qué medida es viable, ya que los tiempos políticos son cruciales, y más en lo que respecta a América Latina, donde los cambios políticos refieren a cortos periodos, y de repente, de no hacer el cambio, se iba a continuar con esta estructura estructura de expansión 15 años más, o por lo menos bajo esa lógica tendencial del crecimiento. Entonces, si bien no estuvo involucrada la planificación territorial, creo que dentro de todo termina siendo un caso relevante para analizar, y más en los próximos años que se podrá ver reflejado cuál ha sido el impacto real que ha tenido en la sociedad. Eso nomás, y agradecer a todos por la escucha y...
Thanks, Luisa. I again encourage you, if you want to do like any other question, you are able to raise your hand on Zoom or write like a specific question on the chat. In the meantime, I have some questions like for the three presenters, so I will take advantage of the time. First for Luisa, starting for Luisa, I will do the question in Spanish, but basically, una de las cosas que tú mencionaste en tu presentación y que me parece muy interesante desde un punto de vista de cómo se planifican los sistemas de transporte es en los temas de subsidio y de regulación del sistema. Una de las cosas que mencionaste es que el sistema comparado con otros sistemas como el de Buenos Aires, por ejemplo, la cantidad de pasajeros por kilómetro puede ser mucho más baja, particularmente en algunos sectores de la ciudad. Y claramente los proveedores o operadores de transporte público usualmente quieren operar donde existe mayor cantidad de demanda. Entonces, me causa curiosidad de cómo básicamente se ha desarrollado eso en el tiempo, cómo es el tema del subsidio, cuánto aumentó con este nuevo sistema y cómo se maneja el tema de la regulación a los operadores para que efectivamente se provea un buen nivel de servicio en estas zonas que son las que tienen mayor nivel de vulnerabilidad o mayores necesidades de movilidad o de accesibilidad.
Nosotros hicimos varias encuestas y una de las encuestas fue justamente el ministro de Transporte, porque también no podíamos comprender que el sistema funcionara, siendo que se cambió literalmente las trazas completamente. Pero lo que nos hizo hincapié el ministro fue que fue un largo proceso de negociación y de implantación del sistema. De a poco comenzaron a comprender que el sistema estaba perimido, porque en definitiva las personas no podían planificar su viaje. Y esto ya era una de las contras que se venía reclamando y que se tenían en las actas de reclamo. El hecho es que no varió la tarifa. En el primer mes de uso liberaron directamente, fue gratuito el servicio para generar un acomodamiento y una adaptación de las personas que pudieran tomar el sistema. Se habilitó en diciembre del 2021, por lo que tampoco es un periodo muy conflictivo, y en enero ya estaba la capacidad prácticamente similar a la del 2019, o sea, nosotros como investigadores también teníamos bastante recelo porque no habíamos comprendido el proceso, cómo fue el proceso de implementación del sistema, y el subsidio se mantiene igual, solo que se reestructura las líneas, se cambian los recorridos completamente. Y se destina por distrito a cada empresa, o sea, se maneja literalmente las relaciones interdepartamentales con el Ministerio de Transporte. De esta manera se logra ordenar y cada departamento, cada localidad conviene en distintas reuniones, talleres con vecinos, se generan debates sobre el funcionamiento, es donde se destinan las quejas. Por eso hubo mucho acuerdo y desarrollo con los distintos departamentos de la provincia. En definitiva fue una reestructuración, no cambia el sistema, el boleto tampoco se modifica. Ronda en los 38 pesos uno de los tramos, y sí es diferente a lo que nosotros, yo resido en Cava y puedo dar fe de lo que sucede acá en Ciudad Autónoma de Buenos Aires, y lógicamente la densidad colabora con la reducción de costos del transporte. Pero en definitiva, los largos trayectos que se generan en San Juan justifica también el monto que se abona por el servicio. Espero haber respondido en parte. No te sabría decir precisamente, pero no ha habido un cambio en cuanto a las tarifas con respecto a esta nueva red.
Excelente, sí, me queda súper claro. Diego.
Iba en la misma línea que la pregunta de Ignacio, pero ¿sabés, Luisa, si el aumento del costo operativo, si el costo operativo del sistema aumentó o se mantuvo igual? O sea, ¿ese statu quo en tarifa y subsidios genera un déficit de algún tipo o sigue manteniéndose en el mismo equilibrio?
Mira, no te sabría responder esa pregunta porque el enfoque desde las entrevistas fue principalmente a actores locales, a la población en sí misma, y también al ministro de Transporte. Pero te lo voy a averiguar y en algún caso, si es posible, te lo respondo a la brevedad.
Gracias,
Mil
Luisa.
disculpas.
Yeah, so I have another question for the presentation of Júlio and Ben. It was really interesting to see like this approach, like trying to mix this approach from above and from below. Personally, I love when like the research approach basically combine these quantitative and qualitative kind of approaches and trying to contrast a little bit. And on that line, I'm curious if you like, what would be for you like the biggest gap or biggest disparities between what you are seeing like with this from above approach, with all the maps that you show from Rafael Pereira and everything, like showing accessibility levels by different transportation modes, and the from below approach? Because like on my experience and reading also like any other literature related to these approaches, usually like accessibility metrics or connectivity metrics fail to consider like transport experience, basically like all the safety issues or experience while walking, or like all the mandatory spacing for biking that you mentioned in your presentation as well. Usually it's not like very well captured when you are seeing like this big picture like from above. So in your experience and in the research, what would be like the biggest gap between what you observe in this from above approach and from below approach?
Well, thanks for the question. One of the main conclusions we came to in this project was that conventional, let's say 3D, the North American walkability and active traveling way of measuring physical quality, let's say the walkability index and other types of measurements, they are not very good to capture this more favela way of emergent patterns, not non-geometric, not planning, etc. So it's very important to customize and to decolonize these physical measurements, to consider many other stuff. But at the same time, Ignacio, we try to move away a bit from, let's say, middle-class morality in terms of personal security, the fear of getting into the streets, because it's a bit different. It's another way of negotiating and navigating the space that low-income people have. So the deeper we went in metrics, in, let's say, quantitative mapping and measurements, we start to find some clues to better measure it, let's say, from above, or in a more blind way, not getting there, not being there. So we discover other ways of measuring that by tracking people, the idea of the minimum path, the shortest path, how people traverse, you know, dumping spaces and shortcuts, etc. So it's a shame that we didn't publish many papers in this very interesting and well-funded project. It's a drawback. We have to admit that we should have published more to show that kind of result. But that's it. If you go deeper, if you zoom in, and if you complement or supplement this hard data with the being there stuff, you start discovering ways of measuring from above, let's say, particularities of the street connectivity assess of public transport, etc. Briefly, I hope I answered
sure. Well, I think that it's never late to publish something. I think that for sure this study is like really interesting. I don't know, Ben, if you want to add something to Julius.
Yeah, I was just going to say, I think one of the successes possibly of the project has been around kind of communicating other data and trying to use the photographs, the GoPro footage, the video. We've had things like walk along with counsellors and so on. Some of the data has been in Oxford. Some of the data has been represented in public health assessments of need and so on. So it's starting to get a counterbalance to the more quantitative approaches that have been used in the past, which I think is encouraging. So I think there's two things to it. One about what Júlio was saying about the existing tools becoming a bit smarter and a bit more detailed in what they can capture, but also using other data to supplement that. And I think there's also a kind of emotional dimension to it, which is very strong. So going away from cold logic of the A to B and actually trying to explain. I think that the whole, like the stories, the narratives, the woman who was dressing down to go out at night to accompany her son in the neighborhood is so powerful as a way of understanding people's experience and the strategies that they use.
Yeah,
so
absolutely.
Júlio, we will. I think that having the opportunity to publish through this avenue has been a great inspiration to us. So there will be obviously the paper from this. So thank you for that opportunity.
Yeah, okay, so we have 7 minutes left. I have one more question for Natalia, Natalia's presentation. So still we have time if you want to like raise your hand or put any other questions in the chat. In the meantime, my question about your presentation is really specific, to be honest. In the quantitative side of the analysis, you use these household travel surveys that are like very typical. And I would say that in the Latin American region are very similar in terms of like methodological things on how to capture like mobility patterns and everything. And I want to know like, basically, how representative do you think that this sample is for like elderly mobility, basically? In the case of Chile, that is the one that I know the most, and analyzing like the Green Destination Survey, after you start like doing some filters, for example, you want to do like a specific analysis for socioeconomic groups or for age or gender, you start to have like a very small sample, even when like you have like expansion factors and everything. So I don't know if you know like how is constructed basically the mobility survey in Bogotá and Belo Horizonte, any like methodological drawbacks or something, or do you think that basically the survey is really capturing like the main characteristics of elderly mobility in terms of like trip purposes, how mobile is the elderly and all that?
Ignacio, you know that research is representative in terms of the households, not in terms of the populational groups. And we only have this sample that it is made in interview the whole members of the family, and we have problems that when we want to try to measure, for example, disabled people or old people, but that is an indirect indicator. The only indicator we have available, because even we are worse in Belo Horizonte because our research is from 2011, and at least Bogotá has a new research in 2019. Yes, and that's why we have problems. And Bogotá, they are trying to improve this representative of this about other groups, but we don't have it in Belo Horizonte. And then that is something that we are going to write down on the paper about the restrictions of this kind of methodology in terms of use of this research. I was trying to answer, I don't remember if Ben asked about the methodology, the use of qualitative methods, and we are trying to do it because we participate in very different scenarios of public agenda of elderly Belo Horizonte particularly. But the problem is difficult for creating a very systematic way to organize this information. It's always about participatory process, as it's not like a very specific and deep interview. And we are trying to do in the second stage of our research, that it would be my postdoctoral program, that we want to interview people from Bogotá and from Belo Horizonte in order to know how they conceive and perceive their mobility barriers and different difficulties that they face.
Yeah, I will say, Nazi, that in the case of Bogotá, they have in Bogotá, there's been like an important effort to make systematic all these data sources. So we have survey for 2011, which is one of the most complete, like in that generation. Then we have 2015, and the 2015 had a lot of caveats, and there was a lot of limitations because they tried to do it with other with phones, etc. And then they did one again in 2019. So the 2011 and the 2019 are actually really good, and we're trying to compare the information. We are using 2011 to have a good number of a kind of comparable information with Belo Horizonte, because Belo Horizonte doesn't have an updated version. But with Bogotá, we're trying to compare what has happened between 2011 and 2019 and see how the survey responds. We know there's limitations in the way they collect this information. For Belo Horizonte, we also have all the collected data from the focus groups with elderly people. So we will have some form of triangulate the information we have. But as Anna said, our intent, her postdoctoral work, and we'll continue working on trying to get qualitative data and understand how that relates to both the policy side and the quantitative data we get from the household surveys.
Yes, perfect. I think we are on time. We have 1 minute left. I don't know if anyone else wants to do a final question, but I think we already have a very interesting conversation, discussion, presentations that of course have some overlap in a great discussion. Happy to be able to share this, to hear from Jorge and from all the presenters. So yeah, I think that if there's no more questions, just to thank you all for the presentations, for also your comments, your discussion. It was great to hear from you all, and I hope you enjoy the rest of your day.
Thank you.
Thank you.
Thank you so much.
Thanks, Ignacio.
Bye-bye.
Thanks, everyone.
Bye-bye. Thank you.
Para de grabar.
Muchísimas gracias. Adiós. Un gusto.